May 14th, 2025, Los Angeles, California. Governor Gavin Newsom announced plans to scale back California's landmark healthcare program for undocumented immigrants, marking a significant reversal in the state's push for universal healthcare coverage. Faced with a growing fiscal crisis, Newsom's revised budget proposal will freeze new enrollment in Medi-Cal's full-scope coverage for undocumented adults starting next year. The change comes as California grapples with a projected $16 billion budget deficit, driven in part by revenue losses tied to tariffs enacted during President Donald Trump's second term. California was one of the first states to extend publicly funded health insurance to low-income individuals regardless of immigration status. Under a phased rollout that began with undocumented children in 2015 and expanded to all adults by 2024, the policy was praised as a bold step toward equitable health care. However, the cost has surpassed expectations. Officials now report Medi-Cal is facing a $6 billion shortfall. To mitigate this, Newsom's proposal includes not only the freeze on new enrollments for full-scope benefits, but also a new requirement starting in January 2027. Adults with what the state calls unsatisfactory immigration status, those ineligible for federal Medicaid, will be asked to pay a $100 monthly premium for continued coverage. While emergency and pregnancy-related care would remain available for new applicants, the broader coverage freeze is projected to save $3.3 billion by the 2028-2029 fiscal year. The premium plan would generate an additional $2.1 billion in savings over the same period. Governor Newsom emphasized that current enrollees will not lose coverage and reiterated his long-term commitment to healthcare access. Yet the fiscal reality is forcing tough choices in a state once seen as a national model for inclusive healthcare policy.